New this morning, this Breast Cancer Awareness Month, we're getting a look at a tool that can maintain a sense of normalcy for chemotherapy patients.
Spectrum News 1 reporter Julie Frendag joins us with more about the DigniCap, which can prevent hair loss. And Julie, I understand that you got to meet a woman who got to use this technology.
Yeah, I did, and the Cone Health Cancer Center is actually one of just a few centers in the region with access to this machine. 18 patients have used it so far, and as you said, I did meet one of them named Amanda Dove. She was diagnosed with stage 1A breast cancer back in June. She told me that using the DigniCap did make her journey through chemotherapy just a little bit more positive. Getting a COVID test is a normal errand for Amanda Dove these days. As a patient fighting breast cancer, she has to get tested before any procedure.
Ready? Try not to move your head. Good job.
She's preparing for surgery this week, 1 month after her final chemotherapy treatment.
Our treatment's done, this course is run, and I'm on my way.
She rang the bell after the last of 12 treatments since June, and she celebrated it while wearing her DigniCap. It's a piece of technology that stopped her from losing her hair.
You can't cover the grays, you can't dye your hair or do anything, so there's a lot of grays in there, but I have kept this stuff, and it meant the world to me.
Dr. Vinay Gadina is a breast medical oncologist at the Cone Cancer Center. He explains to patients that the cap freezes your hair follicles so they aren't affected by the chemo.
It has, enabled a lot of them to go on with their life without informing or telling everybody about their personal health issues. So there are lots of reasons why they do it.
But it's not a perfect fit for every patient.
This is primarily indicated for solid tumor patients. It's not for leukemias, it's not for other malignancies which are not solid tumors. And among all those, only certain regimens it works the best.
Dr. Gadina says the financial burden also stops some patients. It can cost up to $3,000 out of pocket for regular treatment. Amanda Dove's support system of friends and family made it happen for her.
It just meant so much for me to be able to get past that obstacle, that hurdle of the cancer diagnosis.
Because a cancer diagnosis in the middle of a pandemic is not something she planned for.
That was just something that I felt like I had a little bit of control over. I had control over keeping that helmet on, that little DigniCap on, and it paid off. So that was a silver lining in this rough 2020.
One she hopes countless other patients will have access to in the future.
You don't know until you go through it, and I just, pray for all the fellow cancer warriors like me.
Doctors say the DigniCap success rate so far is 60%. However, if patients still do lose their hair, they do say that it grows back with the treatment's help. It does tend to grow back a lot quicker. Doctors are also looking for donors to help offset some of the out-of-pocket costs for patients. If you'd like to donate, you can visit conehealth.com/giving and look for the Alight Fund. In Greensboro, Julie Frendag, Spectrum News 1.